Ladies and gentlemen, I want to thank Coca 2005 for sending this particular article. And it is clearly a sign of the times. Whenever you have addiction, you can best believe you're going to have all types of diseases. And really, all of the hepatitis is linked to drug use in America: hepatitis A, B, and C. HIV is another one that's on the rise in these areas that have a high amount of opioid addicts. And you're really opening the door to many different things. But hepatitis is growing in Kentucky, Ohio, West Virginia, and Illinois. And just to take you down a bit in this article, here are the counties that are affected by hepatitis A right now. And these are 4 states. And you can see the specs there. So it's definitely a growing problem. Definitely. And Kentucky now has about 500 cases, I think 370 cases in Ohio, and of course West Virginia and Indiana. It's just going out of control, but we should not be surprised. We shouldn't be surprised at all. But I'm going to go ahead and play this. I believe this is audio.
Health officials in the Ohio Valley are dealing with a multi-state regional outbreak of hepatitis A, with nearly 500 cases in 4 states. As part of the Ohio Valley Resource Series Rural Risk, Mary Meehan reports this outbreak is just the latest public health threat linked to the region's addiction crisis.
The hepatitis A outbreak, growing in the Louisville area since last summer, reached a new peak recently with a travel advisory from Indiana health officials. They told Hoosiers heading to Kentucky to get vaccinated against hepatitis A. Soon Kentucky's acting health commissioner, Dr. Jeffrey Howard, was pushing back via the state's official YouTube channel.
Some misleading information has raised concerns about travel to Kentucky and even the Derby. Let me say that it is safe to travel to Kentucky, and it is safe to attend the Kentucky Derby.
Later that same day, West Virginia health officials announced a Hep A outbreak in Kanawha and Putnam counties. What started last summer as a Hep A spike in a few counties has grown now to nearly 500 cases in 4 states. That's a number rising daily. Dr. Rahul Gupta is the health commissioner in West Virginia.
One of the things we understand in public health is when we have an outbreak of disease, you can certainly accumulate a number of people having that disease very quickly.
In every impacted state, the rates of infection are well above the norm. Kentucky alone is at more than 370 cases. The annual average is 20. Another unusual factor in this Hep A outbreak is that drug users are at the core. Usually, Hep A outbreaks are caused by ingesting food contaminated with fecal matter.
Individuals who may have substance use disorder and may be using illicit drugs may also not be able to keep up the personal hygiene, which puts them at high risk for being infected with hepatitis A.
Kentucky's acting commissioner Howard says the Centers for Disease Control is tracking outbreaks in 5 states with this unusual transmission. That means Hep A now joins Hep C and HIV as health threats linked to the addiction crisis. That's complicated by the regional nature of the infection.
In terms of the biggest challenge in responding to these outbreaks, is definitely working the outbreaks that are across state lines. For example, we had an HIV cluster investigation in northern Kentucky, where for the first time in the history of Kentucky, we had HIV transmission. It's the most common risk factor being intravenous drug use.
But there are hopeful signs. First, the best prevention against Hep A is a good hand washing with soap and water. Second, there is a vaccine, and all health officials the resource contacted said vaccine supplies are adequate. Dr. James Caskell is the health commissioner at the Athens, Ohio City County Health Department. He feels an outbreak can be contained, but there are constant barriers to treatment in rural areas.
Communication is a problem in Appalachia sometimes.
Dr. Craig Humbaugh is the Fayette County Health Commissioner. He was previously Kentucky's chief epidemiologist. He says it's tough to know the magnitude of any outbreak.
There are always a certain percentage of cases, sometimes larger than others, where the cases are hidden or they go unrecognized.
Better access to testing may be adding to the number of identified cases. Humbaugh says there's now more attention focused on the region's health woes, which could lead to more federal help.
So there's a human cost and a financial cost, but it seems that we are getting more attention.
Those costs, he says, will likely grow as the addiction crisis gives rise to more infectious disease outbreaks through the Ohio Valley. For the Ohio Valley Resource, I'm Mary Meehan in Richmond, Kentucky.
Okay, so you heard that. I'm not going to really read through the article because the audio pretty much just says the same exact thing. But you can see drug addiction has led to many other things that are now impacting not only the drug addict, but really the general public at this point. But please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell. If you have an Android device, please go out and get my app on Google Play. You'll see the link to it in the comment section. And I will see you on the next video. Peace, family.